All right, hello everyone. I'm Ashley. I'm going to be talking about a national patient safety goal that is a concern for all hospitals around. We're going to talk about improving the safety of clinical alarms. Clinical alarm safety has been a huge problem in the healthcare settings. Alarms are used to alert healthcare members that immediate action is required to prevent adverse effects. However, alarm fatigue can also develop and prevent adequate response time. Due to the noisy, busy, and constant alarms going off, healthcare members become desensitized and continue on with daily care without responding. A lack of effort can prevent alarm safety, which can result in consequences that can lead to possible patient death. False alarms can also contribute to threatening patient safety. With proper training of clinical alarms, it can reduce alarm fatigue and improve overall patient quality of care. National Patient Safety Goal. The Joint Commission received 98 alarm-related events. This entitled 80 resulted deaths, 13 resulted in permanent loss of function, 5 resulted in extended length of stay in the hospital. These were between the times of January 2009 and June 2012. Based on the complexity in patient care and adverse effects related to alarm hazards, the Joint Commission urged hospitals to examine the effects of alarms on patient safety. The goal addresses clinical alarms that compromise patient safety if not properly managed. Such alarms may include the cardiac monitors, IV machines, and items containing visual auditory components. Improving patient outcomes. Why is this so important? The need to improve safety alarms is imperative to prevent damaging or irreversible consequences in regards to patient care. It's important for all healthcare members to stay updated on different alarm settings and guidelines to better address issues as quickly as possible. A quality improvement bundle included, this can be eliminating duplicate alarms, changing alarm sounds to most important to least important, daily scan preparations, and replacing electrodes daily. It led to improving patient outcomes. Case scenario. How many of you just stand in the hall and hear all the noise? How many pumps do you hear going off? Bed alarms, telemetry alarms, BiPAP alarms? How many people do you actually see getting up to go address these alarms? Let's talk about a case scenario. A middle-aged female patient was admitted with chest pain and respiratory distress. The patient was non-compliant and refused to keep her heart monitor and pulse ox on. Many times throughout the night, the nurse continued to receive pages that the patient was off the monitor and pulse ox showed 85%. The nurse responded to the patient room in a timely manner and replaced the heart monitor over and over, explained the importance of the device and the need to monitor. The nurse was notified again that the patient came off the monitor. This time, the nurse was busy and thought to herself, hey, this patient been doing this all night, so I go check on her later. I'm doing something right now. So once the nurse finally went to check on the patient was dead. Did alarm fatigue contribute to the safety of this patient? In this case, excessive false alarms may lead to unintended harm. This case provides the opportunity to consider the benefits and potential harms associated with the magnitude of alarms in the hospital settings. Implications for nursing practice. According to critical care nurses have the ability to improve clinical safety alarms. This can be done by understanding the process, developing alarm response plans, providing orientation of devices to all members of the healthcare team, and clearly define responsibility for monitoring and responding to the alarms, and learning to identify priority alarms on the unit. Understanding these factors will equip nurses to implement strategies for alarm management to improve patient outcomes. Proactive alarm management is the best way to reduce alarm hazards, reduce excessive alarms, and prevent alarm fatigue. Nurses' perspective. Patient safety will be improved by having a monitor tech to observe cardiac monitors. Nurses are sometimes overwhelmed, got high patient ratios, and may be caring for another patient when the nurse is paged. So a monitor tech is considered a second eye for the patient. and manufacturers should also improve the overall function of the devices to reduce fatigue. And significant staffing may possibly improve response to high priority alarms as well. And DCM monitoring when no longer needed. Nurses' involvement in reviewing current policies and reconstructing alarm systems will certainly improve patient safety. Alarms and attitudes and practices. Nurses are the most directly affected by the magnitude of alarms and can provide creative and effective solutions to hazards that alarms have become. Individual hospitals should take a team approach to safety issues by focusing on frequency of alarms, management practices, and staff knowledge. Implementation of long-term comprehensive improvement projects resulted in reduced incident of false alarms. Customized alarms thresholds to specific patient and units needs can also prevent fatigue. With these specific practices, patient and staff satisfaction has increased, noise level reduction, and frequency of alarms also decreased. Safety symptoms. Perhaps hospitals would pay more attention to this specific patient safety issues with the implementation of the Joint Commission on Alarm Management. An example of an escalation plan, the primary nurse is prompted by alarm. If the alarm is not addressed in a timely manner, the alarm is automatically sent to another nurse. If the buddy nurse doesn't respond, whoever, like we're going to room, my name shows up. Whoever is closest to the patient, it will automatically go to their pager to alert them to go check on the patient. And based on the area you are located in will aid in the effectiveness of this practice and timely response. Communication is also important, like our communication devices, pagers, phones, to allow you to respond in a promptly manner. Focus on patient population, staffing, agricultural layout, and alarm coverage models reduces risk and continually provides effectiveness of alarm management. As we listen to all the benefits of alarm safety, as a team, we can improve the overall function of the unit and most importantly, improve outcomes and safety. Thank you all for your time.